Hi, I'm Dr. Terry Litchfield. I'm the Sussex County Chiropractor. I'm here in Andover Family Chiropractic Center. I've been here for 35 years, and this is Amanda. We're going to check her out today. She came in last week with symptoms of having a concussion, and I'm going to ask Amanda how this took place. Amanda, what happened?
In cheer, a girl fell on me after we were stunting, and I fell on the ground and my neck cracked.
And did you hear any noise or anything like
Yeah,
that?
it cracked.
Okay.
5 times.
So what happened after that? What happened? How were you feeling?
My head was fuzzy, like I couldn't concentrate well. I was dizzy, and the light affected my head, and I was really tired a lot.
Okay. Did you have a headache?
Yes,
Okay. Where was your headache?
right here.
On the back.
Yes,
Okay.
on the back.
And what else? Did you have any digestive issues at that time?
My stomach hurt a little. I felt nauseous a few times.
Okay. So you came into me with these symptoms last week. Right now, I've seen you already twice last week. This is the third time I'm seeing you. How are you feeling right at the moment?
I feel much better. I can concentrate way more, and I'm doing better in school since then. And I stopped having headaches, and my stomach's
Good.
better too.
Good. But you said yesterday you went to practice.
Yeah.
And what happened after practice?
And I felt very nauseous
Mm-hmm.
and dizzy-ish,
Mm-hmm.
kind of, because I was jumping a lot.
Okay.
Yeah.
Okay, so I want you to just look at me, okay? Turn your body towards me. I want to see how you turn your head. Turn your head all the way to the right as far as you can go, and that's very good range. Turn your head all the way to the left as far as you can go. Excellent range. Chin to your chest, and bring your head up and back for me. As far back as you can go. Good. Any pain upon those motions?
No.
Any dizziness?
No.
Okay. Gonna push gently on the head. Any pain?
A little.
And where do you feel that?
In the back.
In the back of your head. I'm going to pull gently up. Any pain when I do that?
No.
Good. I'm going to ask you to push your head into my hand. Any pain upon that?
A little.
In the neck muscles. I'm going to push back into my hand. Push back into my hand. Any pain upon that?
No.
Good. Push your head this way and push your head this way. Okay, now with both arms straight out, just hold them up for me, just like that. Hold them up. Good. They're nice, equal and strong. Squeeze my fingers. Beautiful. Face down for me. Now I'm going to take a look at the spine and see what might be going on in the spine. I'm just going to place your hair to the side, and I'm going to palpate the neck. That means touching the neck very gently. And again, her neck muscles are very tight, especially back in here. Do you feel that?
Yes.
And how about over here when I touch?
Yes.
Good. How about in here? Do you feel that when I touch?
Yes.
Good. Coming down, you feel it in here?
Mm-hmm.
And here? I mean, is there pain when I touch here?
No.
No. But when I touch here, you do feel a little
Yes.
sensation. And when I touch here, you do feel a sensation.
Yes.
Okay. Now I'm going to go down and test the strength of your legs. Hold that up for me. Okay, that's a little weak. Hold this one up. Both of them are a little weak. So now I know where to go. I start back behind the occipital ridge, and I ask you to breathe in and out. And again, breathe in. It's a gentle rocking motion of the occipital area, which is the base of the brainstem. The brainstem extends from there and goes down the cord. Take a deep breath in and out. And I go back to the sacrum and I rock it gently. Take a deep breath in and out. And again, breathe in and out. Good. Now I'm going to go back and check the legs. Hold them up for me. Now they have full strength. Hold it up. Full strength. Now, with the leg, with both hamstrings being strong, I'm going to use them as an indicator muscle to help me find out where the nerve interference is within the spine. A chiropractor calls nerve interference subluxation. So this is what I'm looking for, and this is all a chiropractor treats, is the nervous system and the interference that is called subluxation. Bend at the knee. Good. And bend at the knee here again. Good. Now I'm going to touch the SI joint, hold it up, and I'll move over here, and you see the leg goes weak. So I know there's interference right here. And with that, I know in the neck, C3 is involved also. So I'm just going to give it a gentle little awakening that my hand is touching it. And then I'm going to ask you to breathe in and out. And again, and out. And I'll go to the neck and a very gentle pressure. Take a deep breath in and out. And again, breathe in. It's like pumping the vertebra to get it to move again, to take the interference away. And now I'm going to check again. Hold it up. Here, here, and now that I'm touching here and here and the leg stays strong, I know I've cleared out the interference. So now I move up the spine. And here we have L5S1, showing that it has a little nerve interference here. And I know from the anatomy of the body that L5S1 relates to the very, very first vertebra in the neck, C1, which is the atlas. Hold it up. So I know I will find something with that also. Right in here is also related to digestion. Take a deep breath in and out and just let it go. Excellent. That little noise you hear is release of nitrogen gas because each disc has a liquid center, and when it gets displaced slightly, it creates a high and low pressure. Take a deep breath in. And when you reestablish the pressure, you get the vacuum sound, which is a suck, like that. Hold it up. And again, right up here, C1. Take a deep breath in and out. And again, breathe in and out. Again, it's a gentle rocking pressure. Nothing forceful. Moves with the breathing. And again, breathe in and out. Now, because I know Amanda said she was spotting somebody, she was holding somebody above with her hands, I'm going to ask her to raise her hands up. That's it. So she fell with her hands up backwards. Hold it up. And right there. This is the end of the rib cage. So now that I found the end of the rib cage, I know the top of the rib cage is going to be involved, which affects her arms. Good. And hold it up. And right there. And again, this is the top of the rib cage, and here on the right is extremely tight compared to the left. Take a deep breath in and out. Let it go. Good. And we actually got a nice release of that first rib head. Hold it up. Now we have the lower cervical, which is C5, and again it's just a gentle pumping action of the vertebra. Take a deep breath in. I use her respiration to help me. And one more time, deep breath in and out. It's non-force. It's not forcing anything. Hold it up. Good. Turn over on your back for me. There you go. Good. Now I'm going to ask you to hold this leg up. Beautiful. Try this. See, there's a little weakness there. So I'm just going to show the people. You're going to take this finger. You're going to put it right here on your neck. Now hold this up. See the difference in the leg? Take it away. Hold it up. The leg is weak. So I know just by that test that there's interference here in the neck affecting this side of the body, this leg. So what we're going to do, it's a non-force technique again. We're not forcing anything. But I'm just going to go and palpate. Again, palpate means touch. I'm going to touch C5, and I'm going to give it a little vibration. Just a little vibration. And again, a little vibration. Good. Now hold this arm up for me. And C5 is nice and strong. So we'll go back to the leg. And I want to demonstrate the difference. Hold it up. See? The leg's nice and strong. We release the interference in the cervical spine, helping the transmission of the nerve down the leg. Let's have both arms. Hold them up. Arms are strong. Wonderful. Now we go to the next part of the exam, which is addressing the cranial nerves. And the cranial nerves relate to the head and the face. And because she still has a little bit of a tight muscle here, I'm just gonna vibrate it a little bit with my fingers. Give it a little pressure point here to break it up. It's called a trigger point. Any kind of trauma produces trigger points. And just again, a little stretching of the neck, a little working of the muscles, coming up the spine. And I feel a little bit going on there, a little tender there.
Yes.
Yeah. Hold it up here for me. But I'm going to check it. And yes, it does have a little interference. So again, it's a vibratory motion, very gentle, very specific to where the interference is in the spine. Again, chiropractic term is subluxation. Put it back down. Pull this up. By the retesting of the area I just corrected, by the fact that the muscle is strong, I know the correction is complete. So hold that up here for me. Now I'm touching her jaw and touching here. And again, the arm just goes weak. Now this is the TMJ, which has the 12 cranial nerves that are associated with it. It's part of the parasympathetic nervous system. That's the nervous system, the part that counterbalances the sympathetic. They're part of the autonomic nervous system, the two parts, sympathetic, parasympathetic. The parasympathetic is out of balance with the sympathetic. The sympathetic is the thing that keeps re-stimulating the problem. So we're going to try and balance this out for her today. A little bit of jaw work, very gentle, non-painful, non-forceful. Now hold it up for me. Retesting, perfect. Now I'm going to ask you to do some functions of the jaw which isolate different cranial nerves. Open for me the mouth, and bite, and chew. Yeah, once you chews, keep chewing a little bit. That's it. This is isolating the cranial nerve that is necessary to be reset to help the body function better. And hold it up and chew for me. Now go side to side, back and forth. Good. Now push the bottom jaw forward of the front teeth. It's still a little right in here. She's a little tight still in here. Push the forward of the front teeth. Pull it back. And swallow. Good. Now I'm going to check. I'm going to connect the labyrinth, which is the back of the skull, to the eyes. That's part of how I find a fault for whiplash. It might be gone because I cleared it out last week. And then also with the ears, I connect the ears to the, and still a little bit here going on with the ears. So it's just, again, a gentle rubbing, tapping, vibratory motion. Hold it up. Now I'm going to ask her to point her toes down and flex your toes up, all the way up. That's it, get those heels all the way up. And as I go down the cervical spine, again at the lower end of the cervical spine, I find a little bit of a reaction to the fact that she has her Achilles tendon now working, and it still shows it needs a little help. We're stretching the cord now. We're getting it to rock again like it's supposed to. And when it rocks properly, the cerebral spinal fluid could move up and down the cord very fluidly. And that's what we want, because that'll take away all the other pressures of the head. Point your toes down and flex your toes up. Good. Now turn your face this way. And turn your face this way. Right there. Let that relax. Still a little here. And just a little vibration. Good. Hold it up here. Good, good, good. Back in the center. Hold it up. Point your toes down and flex them up. just going to touch the stomach area and take a deep breath in for me. And take a breath out. Okay, we have a little weakness there. So I'm just going to ask you to take a deep breath in. And again, it's a little gentle vibration with a end thrust right at the end. Take a deep breath in and out. Because the diaphragm also in an injury gets contracted. Hold it up, which would affect the stomach also. Let that relax. And now that I release the diaphragm, it's showing a little bit more neck muscles that I have to work on. Hold it up here. And again, I'm going to ask you to point your toes down and flex your toes up. Full breath in, full breath out, and everything staying nice and strong. The adjustment's complete. There you go, Amanda. Have a good day.
Thank you.
You're very welcome. How do you feel right at the moment?
Good.
No headache? No
Mhm.
funniness in your tummy? Good,
Yeah.
good. Very focused, very clear. You can go home and do good homework?
Yes.
All right, very
Thank
good.
you.
Thank you so much.